Okay, I've arrived on scene. My scene is safe. I do have my VSIs on. It appears I have one single male patient. There's nobody around to tell me what might have happened. However, it is snowing out and it is slippery. We're going to be careful not to slip. It appears as though my patient may have fallen down some stairs. Due to the suspicion of trauma, I'm going to have my partner hold manual inline stabilization. Checking for responsiveness now. Hello, sir, can you hear me? No response. I'm going to check for painful response to painful stimuli, pinching the shoulder, pinching the ear. No response. Going to go into my ABCs now. Due to the suspicion of trauma, we're going to use a modified jaw thrust to check the airway. And I do have gurgling respirations. So to treat that, I'm going to suction my patient for no longer than 15 seconds on the way out. And it appears that I have cleared that up now. I am going to drop an oral airway to maintain my patient's airway from this point forward. And I'm going to have my partner assist respirations via a bag valve mask with high flow O2 at a rate of 15 liters per minute at a rate of 12 to 20 breaths per minute. Getting into breathing now, I do have adequate chest rise with, again, the assistance from my partner who's bagging him. And I'm going to check for circulation now, checking my carotid and radial pulses. And I do have pulses. The radial pulse does appear to be diminished. Checking for skin condition and temperature now. And I have a cool and diaphoretic patient. I'm going to expose my patient's chest and torso now, checking for any sort of obvious injury or obvious bleeding. Nothing is found so far. Going to check my patient's back, posterior side, starting with the head, the neck, through the abdomen, hips, extremities. I'm not finding anything. Due to the patient's condition thus far, he is a candidate for rapid transport. I am going to request a paramedic intercept, and my partner is going to go and retrieve a backboard so we can extricate the patient from the scene to the ambulance. While he's doing that, I'm going to begin my primary assessment. Starting back up with the head, I'm going to palpate the head, check for any more injuries above the eyes, the cheekbones, mandibles, zygomas, the nasal bone, nothing found there. My patient's airway is still being maintained by the oral airway as well as assisted ventilations from my partner. Checking the neck, front and back. Gonna check for pupil response. And I have slow response to light. Checking my patient's ears for fluid, blood, checking for vital signs. Checking the nose for blood. Moving into the shoulders, checking for any sorts of injury. Going to gently palpate my patient's rib cage. Not finding anything significant here. While I'm here, I'm going to listen to lung sounds. Moving down into the abdomen now, checking for tenderness, rigidity in the abdomen. Going to compress inward on my patient's pelvis, checking for stability there. Everything looks good so far. Moving into extremities now. I'm gonna check my patient's arm, checking for tenting of the skin. Can you squeeze my hand? Cap refill down the leg. Checking the distal pulse. Can you push down? Can you push up? Cap refill. And I'm going to repeat the same process for the other extremities. Cap refill. Can you squeeze my hand? And now it does appear that I have a leg injury. My patient's right upper leg. I do have a fair amount of swelling and bruising. Checking for distal pulse, it is diminished. Can you push up? Can you push down? Checking for cap refill. Now I'm going to log roll my patient and perform a quick scan of the back. But before I do that, I need to check for JVD one last time, and I don't have anything found thus far. So now I'm going to roll my patient as a unit, checking the back of the legs, and I have nothing found there. Now that I've got my patient on the backboard, we are going to move them to the ambulance. And once I'm in the ambulance, I'm going to begin my secondary assessment, which is a more thorough assessment. Starting again with the head, checking for any injuries, bleeding, the back of the neck, the front of the neck. I do have a collar on my patient now. I am able to again reassess for JVD. And everything looks normal there. The airway is still being taken care of. Checking around the eyebrows, under the eyes, the cheekbones, nasal bone. Everything's looking good with the head. Down into the chest area again. I'm reassessing the stability of my patient's chest wall. Everything appears to be normal there. I am going to reassess lung sounds. Moving down into the abdomen, checking the 4 quadrants for rigidity, tenderness, anything like that. Checking the pelvis, everything still appears to be normal. Moving into the extremity check again, checking my patient's leg for any further injuries. Arms again. I am going to obtain a blood pressure while I'm up here. Okay, I have a blood pressure of 168 over 96. Continuing on with the extremity assessment. Now that we are in the ambulance, I'm going to have my partner work on stabilizing the injury here with a splint. Continuing on down. And from this point, we are going to receive the paramedic intercept, and we're going to continue to reevaluate every 5 minutes. I'm also going to get my patient on a 12 lead and provide the paramedic with that information upon their arrival. That's it.